Recently, 2 school children tested positive for norovirus in Kerala. What is norovirus? Is it dangerous? How to prevent it? Is there a vaccine for it? In this video, we will learn about norovirus and try to answer all these questions. We are looking at the map of the United States of America. Here you can see the city of Norwalk in Ohio. In 1968, an outbreak of acute gastroenteritis occurred in an elementary school due to a viral infection. Acute gastroenteritis is an intestinal infection that results in a combination of nausea, vomiting, diarrhea, and abdominal pain. The virus that caused the infection was named the norovirus after the city of Norwalk. Norovirus is a single-stranded RNA virus. That means its genetic information is stored in the form of RNA and its replication occurs in the host's cytoplasm. Norovirus outbreaks can happen anytime, but they occur most often during the winter months, which is why it is also known as the winter vomiting bug. As it causes inflammation of the stomach and intestines, it is also called the stomach bug. It is not related to flu, which is a common respiratory illness caused by the influenza virus. People infected with norovirus can shed billions of norovirus particles that cannot be seen with the naked eye. However, only a few norovirus particles are sufficient to make other people sick. That means it is highly contagious. Even infected asymptomatic people can pass on the virus to others. Also, reinfection is possible as the virus has different strains. According to the Centers for Disease Control and Prevention, which is the National Public Health Agency of the United States, the virus can stay in the stool of recovered people for even more than 2 weeks. But wait, how does it get transmitted? Well, the virus can be transmitted directly from person to person and indirectly via contaminated water, food, infected surfaces, as well as through the air. In fact, norovirus is the leading cause of foodborne illness. Obviously, the infection spreads more easily in closed and crowded settings like hospitals, schools, cruise ships, etc. Alright, but what are its symptoms? Its symptoms include vomiting, diarrhea, stomach cramping, fever, chills, headache, muscle ache, etc. Since a substantial amount of fluids are lost from vomiting and diarrhea, there is a risk of dehydration. Symptoms usually develop within 12 to 48 hours after being exposed to the virus. Okay, so what can we do to prevent it? In short, cleanliness and hygiene. As no vaccines are currently available to prevent the virus. That is, washing hands frequently and properly, washing fruits and vegetables properly, cooking thoroughly before consuming, especially shellfish, disinfecting contaminated surfaces, etc. What if one gets infected? Generally, this disease resolves on its own without treatment. In other words, the disease is self-limiting. Most people get better within 1 to 3 days. Taking sufficient rest and increasing the fluid intake, thereby staying hydrated, is recommended. Should one take antibiotics? The answer is no, because antibiotics fight bacteria, not viruses. That is all for this session. Today, we learned briefly about norovirus. I hope that was useful. Thank you for your time.